This is our second round of looking at Reopen Evansville and ways to help and be of assistance. Today, we will have two wonderful members from the health department, Lynn Herr and Joe Grease, and they are going to be talking about Reopen and what's happened with the COVID-19 from the health department perspective. And we're so excited about this because when we met with Steve Schaefer last week, so many of the questions and the things that people cared about and how they felt, they were centered around health. And I happen to know from doing radio show with you all and talking to you on a pretty regular basis that some of the things that you are doing in the area of health and through the health department, I think would alleviate, I think, some of the concerns and fears and answer a great number of the questions. So what we're going to do is, first, before I forget, everyone that is on the call or on the Zoom, I want you to remember to put, if you can, your name on the front of what we can see so we can tell who's going to be here and keep track of that. Also, I think we've got a data sheet or a demographic sheet that we will either send to you after the fact, but what we really need you to do is put in the chat your email so that not only we want to be able to give you the information and the learning that we have today, but we also want to make sure that we can give you and get from you the information we need to keep track of the demographics. I think even if you've done it before, you've been here before, we want to make sure that we know you were here more than one time, if that makes sense. Okay. At this point, staff, did I forget any other overview that we want to talk about before we get started? Did I forget anything?
No, you didn't.
Okay, cool.
You did real good.
Once we do, and we hear from Lynn and Joe from the health department, we'll go through the exercise of 6 thinking hats, and we will go through each way of thinking with everyone using the chat so that we can get the information we need. And we will hear possibly from 1 or 2 persons who wants to speak about it in each one of the different 6 ways of thinking. We will also give Lynn and Joe an opportunity, if any of the questions are something they want to address right now, we can certainly do that within limits. Anything we don't get to will get answered as we move forward after the fact. All right, so Lynn and Joe, do one of you want to go first or second? Do you know which one?
Go ahead, Lynn.
Lynn Herr is going to go first. And Lynn is such an asset to our community, as is Joe. They work so hard. And I'll tell you what, I want to give a huge thank you to the health department because they have been that incredible, credible source of information and direction during a very difficult time, both going into this and now as we're trying to step to reopen. So Lynn, don't forget to say your title and stuff because I'm afraid I would have goofed that up. So first, okay. Lynn and Joe. Oh, and then everybody go on mute until we're ready to talk so we can't hear everybody's chat and stuff. All right.
Okay, Lynn, where would you like me to start?
Well, I wonder if you want to give accurate information about COVID-19, what we need to be doing to stay healthy and safe. And that's before reopen, kind of where we've come from, and then going into reopen, what are some of the things that it's really important that we keep in mind. And if there's something beyond that, I mean, you know your topic better than I do, so please.
So basically, I'm the director of clinical and outreach, and I am helping work with the team that is doing disease investigation, and what that consists of when a person is exhibiting symptoms they have the option right now of going to 2 different testing centers. One is at St. Vincent and one is at Deaconess. Those are call ahead. At this time, we are still only testing individuals that are symptomatic. So I think there is a misconception sometimes that, oh, I just want to go get tested, or my employer wants me to go get tested before I go back to work. We really can't do that here in Vanderburgh County yet. So I'll continue on. Once a person is deemed positive for COVID-19, that test is reported to the Indiana State Department of Health and put into a database in which we pick that up every day. Then one of our nurses will call that person and do an in-depth interview to see when your symptoms started and how you're doing right now. You will remain on isolation, staying at home for 3 days past your last fever and improved respiratory symptoms, and at least 10 days has to pass since those symptoms started. So we have had folks on isolation for their symptoms being positive from anywhere of those 10 days up to almost 6 weeks, depending on how that client is doing. At that time of the interview, we do receive or get the information of who those close contacts are. And a close contact is deemed any person that you are within 6 feet of that you have spent at least 10 minutes with. And we also at that time notify any employers in which, you know, this person that is positive would be at. So let's say they were a healthcare worker, we would notify their place of business, and then we need their help, like any other employer, to find out those individuals they were close to at work or who they might have exposed at work, whether it is a patient, whether it's another employee, whether it's a client, to be able to decide who else needs to be reached out to. That employer, so it could be anybody in town, basically, we would call that employer, let them know that they have a COVID positive employee, and they would begin their disease investigation and going through their policies and procedures for COVID as well. We do watch for trends in which there are places where there are several positives, whether that's a nursing home, whether that's a packing plant, whether it is at an institution or just a general business. So we follow those trends. We also follow the trends. We have a whole data team. Once we put this information into the database, in which they can draw all kinds of conclusions, like which zip code has the highest positive cases, what race has the most positive, if there are any disparities within racial groups. The sex, whether they were admitted to the hospital or where they recovered at home, how many days it took to recovery, and a multitude of other things. And that is what we put on the Vanderburgh County Health Department site. Now, Joe could probably go into how we've worked with our community partners and the mayor and the task force, and what our role in that is. So Lynn, is there anything else you have questions on my role at the health department?
What is the recommendation of the health department to just a general citizen? What should we be doing and what should we not be doing in order to be the safest for everyone, not just ourselves, but the whole community?
Sure. So we start with our 6 foot distance. When we're out in public, To protect others, we wear a mask. We practice good hygiene, meaning washing your hands for at least 20 seconds with soap and water, or using alcohol-based hand sanitizer. If we are sick, we stay home, and we have good cough hygiene. Like I said, wearing your mask when you're outside your home, or whether if you've got somebody inside your home that you want to protect, but maintaining that social distance, washing your hands, and if you're sick, stay home, please. If you're running fever or you have a cough, this isn't time now to go to Walmart to pick up groceries or do other things. The other thing is to monitor your temperature if you're feeling ill.
Very good. Oh, thank you so much. And Joe, could you give an overview or what you feel is important for you to share about the ways in which the community has come together, the kinds of collaboration that have happened based on the health department and other organizations, agencies, government, whoever you've been working with?
Absolutely. And it's really been a process since this began. Early on, I think in Evansville, Vanderburgh County, really southwestern Indiana, we've worked with so many different groups, from local government to local law enforcement, first responders, both hospitals. Everybody's really been a part of the process. We also work with all of the other counties in Southwest Indiana. We have direct links and meet with the other health departments on a weekly basis to share, things that are going good, things that are maybe somebody needs help with, questions. We get questions every day from the community about, well, this is happening in this business. Should they be doing this? Or I want to do this, and as I open up. And the governor's plan has spelled a lot of this out, but I think there are a lot of questions too. And that's what we're here to help with as well, to make sure that, people get the good information that they need so that they can operate their businesses as we start to open up, as things start to get things going again, which we want and we need to do. But there's recommendations, there's guidance, and we want people to reach out to us so that we can help provide, the good information, answer those questions, and help everybody through this as things progress.
Awesome. Joe, Lynn, is there anything else on that you want to make sure that people hear? I mean, just if you got an opportunity to tell as many people as possible something that from the health department, what would that be?
For me, and for I think as working with local government, I think the key is we can open up. The governor's plan is a good plan. It's very measured. As long as people are following guidance and doing things to protect themselves and others, this can work. The governor has a really good plan. And here in Southwest Indiana, we're doing really well. Vanderburgh County, we've had only 2 deaths. We've had many, many cases, but a lot of those cases have since recovered. Even many of the contacts, have recovered as well. So, there still is some spread there here in the community, but I think things are moving in the right direction. And again, we're here to help any way we can and answer questions, help provide information, and please reach out to us through our website, call us, and make sure you get your questions answered.
Awesome. And we'll put the information how to get the website for the health. We'll get their gosh, I just lost my words, but we'll put that up on the chat to make sure everybody can get to the health department. Woo, biggie. Okay, Lynn.
No, I'd probably jump right on to what Joe was saying. I think, as we move forward, I think it is doable. I think we've got the things in place that we need to do contact investigation to be able to slow the spread. And as long as we're all working together, and when there's issues that arise, that people reach out and try to take measures to slow the spread, then we're in a good position.
Very good. Very good. Well, then I think at this point, I'm going to go through and do the different ways of thinking. So what we'll do is I'll ask the people on Zoom, and I think Elizabeth is getting ready to put this up on. Elizabeth, I'm not sure I know how this is different than what I'm used to. Hold on, there it is. Okay, so the 6 ways of thinking from Edgar de Bono ask specific things. So the first way of thinking we're going to go for is about information. So what information do we still need to understand better? Do we still need to understand better? So having to do with health and the health department and the folks that are on Zoom, if there's a chat question or a chat way that you can say that would be amazing. So let's see if so people that are looking, what information do you still feel you need? And even if it's stuff that you asked last week, it's okay to ask it again with the health department with us. And then you can put that in the chat if you're used to using the chat form.
Hey, Lynn, we had a couple of people ask questions right before we started this. Anna asked, she's heard a couple different things and wants to know if it's true that a fever is classified if it's over 100 degrees.
It is. It's over 100. What used to be the CDC originally when it came out started out 100.4, and they changed that a couple weeks into it. So a fever is any temperature greater than 100.
Okay, very good. What was the other question? I'm having a hard time seeing it. Andrew, was there more than one?
Yeah. Katie Taylor asked, how many cases do we have in Vanderburgh County right now? Reported cases.
Hang on just a minute, and I'll give you the exact number because we've done other things today, and I have been catching up. And let's see what we have. I know it's over 200 now. And the greatest place to go and do this is our website. We have a COVID page in which it is updated on a regular basis. And so,
And
237.
Lynn,
Yeah.
when you get those numbers, give them also the number that we're still following.
Right.
That's important because the number of cases is one thing, but there are many, many people that have recovered and aren't at risk and aren't able to put others at risk either.
Right. So on our webpage, and if you go there, it says we have 237 confirmed cases. And then we have 493 contacts. So those confirmed patients identified 493 contacts. Okay, I hope that makes sense. We also have closed, meaning they have recovered and done well. Those confirmed cases out of those 237, we have 203 that are now recovered. So that's very good. And the contacts, we've cleared 340 of them. That means that we're no longer following their 14 days, they're up. And that means that they either became a confirmed case or they did fine with their self-isolation and never did contract COVID. We've had, like Joe said, 2 deaths. We're following 153 contacts currently and 36 confirmed cases. And those will change on a daily basis when we update our website so that you can always follow that data.
So, Lynn, do the people that are contacts, so if I have COVID and I had 13 people I came in contact with, do the 13 people get tested?
Well, when they become symptomatic. We are in Vanderburgh County not testing those clients that are not symptomatic. We do not have the ability to do that yet. So the reason we want you symptomatic is because that means you have enough virus in your system to produce a positive test if you are positive for COVID. If you're asymptomatic, it just means, you know, we could do a test, but you may not have, the thing is, if it's too early, Lynn, it may give you a false negative. And so that's why we like you to be symptomatic.
So even the people that you're not testing, you tell them to treat it like they have it? Is that it? Do they go into isolation?
Yes, they self-isolate for 14 days.
Okay.
And we follow up with them during that time. We call and see how they're doing, and we follow up.
We have a couple more questions in the chat regarding immunity after someone has recovered from COVID. So in other words, after someone has contracted COVID, had symptoms and recovered, have we been able to prove that they are no longer able to catch it?
You know, there is still so much unknown that we don't know about. And antibody testing, I'm sure you guys have kind of heard about that, is not widely available yet. Eventually, we will have that here, but we don't have it. So I didn't answer your question, and I realize that because there just hasn't been enough guidance to us from the Indiana State Department of Health of what that plan is for antibody testing and how we're going to follow it.
Very good. There also seems to be some more questions having to do with making sure that people understand that masks really are important to wear because we're not sure if we have it or not, right?
Right. Right. And so it's not about protecting yourself with cloth masks or procedural paper mask. It's more about respect for others, of a way to cover your cough and to make sure that we're not spreading it unintentionally.
Yeah. So the mask is to protect people around us, it doesn't keep you from getting it. It keeps you from passing it.
There's a lot of good graphics that I'll share with you maybe at a later time, Lynn, that actually shows why you should wear a mask on, you know, and the protection of others.
Very good. Very good. Andrew, anybody else see some other questions that are?
Yeah, Katie's asking if we have another outbreak. So if there's like a second wave, are we prepared, and do we have enough tests to test everybody that would need it in that situation?
I would hope so. I would hope we would have enough tests. But the big thing about that is not only do we have enough tests, what we worry about is having enough hospital space and ventilator space to be able to take care of positives. So we stay in close communication with both of the local hospitals and have plans in place if we have to maybe have a big intake of sick folks, then we'll be ready to do that. And that's why we didn't open up originally, just kind of trying to flatten the curve and let the hospitals get a plan together for hospitalization. Mobilize those plans.
Awesome. All right. Now, if another informational thing comes up in your mind, be sure and put it in the chat. If it's later in the discussion, put white in front of it, information in front of it, so we can get it in the right category later. Because sometimes, let's go to the next way of thinking. Okay, so this is talking about the benefits of opening up the community, even knowing that COVID still exists. So what are the potential benefits and the logical reasons why we should? And
So
this
Joe,
is in terms of health too.
Joe, do you want to answer the benefits, the financial benefits of this?
Yeah. Well, obviously, if our economy goes south, none of us are going to be very well off. And you see stories every day across the country, different states opening up and get things back up and going. Again, all of these need to be very well thought out plans. And what Indiana has done with Governor Holcomb, they have put together a very well thought out plan. They have addressed different types of businesses throughout the state, different types of government operations, of businesses, restaurants, summer day camps. They have a section just for summer day camps and daycares, and they're working with many different state agencies, the ISDH, FSSA, all of these different agencies at state level are also weighing in and providing their guidance, when they develop this plan. The key is, we have to get things going, but in a measured way, so that we don't hit another spike. We've been open for a couple weeks now here in Southwest Indiana, or in Indiana as a whole, and we've continued to see additional cases each day, but it's nothing that where we've seen a huge spike where we're increasing the number of cases going up every single day. We have maybe some days we have a couple days where it's 9 or 10 cases, but then we'll have days where there's 1 or 2. So and that's happened from the beginning when we've seen cases in Vanderburgh County. So it makes sense to get things moving here, and the benefit is to all of those who have been out of work, who need to make money to pay their bills, put food on the table, those types of things, and that's what we need to also take into account here, is that we can do this in a measured way and be successful and still protecting ourselves.
Very good, very good. So we've got a couple of people writing things. Josh, do you want to share what you're doing? And this is back to White. He thought of another one. I want to go ahead and take care of that before we move on. Josh, do you mind just sharing that? Josh Case, do you mind coming off mute and talking about what you wrote on the chat? Okay, I'm going to assume there's a reason why he can't. So he said, having heard drastically varying timeframes for vaccine, 4 months to 2 years, what is the actually educated estimate on having one available to the public at large? So what's going on with the hope for vaccine?
Joe, I'll take this one.
Okay.
There's just things we do not know yet. We know that once we get it, probably the health department will be one of the very first places it will arrive, and we will have to develop a plan in which we've already started talking about a little bit on how to vaccinate. If I was just given an educated guess, I would not expect it before the end of the year. There's different industries or different manufacturers in the process of this. It is just a lengthy process in between, trials and making sure that it's safe for humans, and then that it's effective. There's no sense in giving a vaccine if it's not going to be effective. So there's just several more stages that we need to go through before we can really, truly give an educated guess.
Very good. Okay, So now back to the yellows. Would somebody else like to share about what they see as the positive benefits or the logical reasons to move forward from our group?
This is Anna. Just kind of from the economic perspective, I listen to a lot of people every day, and there are some people that estimate, 2% of small businesses either won't reopen or will really struggle to reopen every week, that the economy is either totally or partially shut down. So not just for our area, but, as some areas go on 10, 12 weeks that have not begun opening up yet, some people estimate that 20 to 25% of small businesses will really have a hard time reopening. And it's also an emotional piece that people get used to also not working. And they kind of lack that motivation. I mean, I know the longer I go without working out, the less likely I want to do it. It's just, human nature of how we form habits. And we have some clients who, even though they're trying now to reopen, are struggling to get people to come back to work. So, continue to reopen. We just need to get everyone in the workforce back to that point of, where they have that dignity and can, support themselves when they're able to.
And Lynn, Joe, what is the role that the health department has played in helping businesses reopen? I know that restaurants have to go through a certain amount of things. You've really had an active role in helping companies get back on their feet. Can you share a little bit about that?
Yes, the health department has put out guidelines. Well, we have shared the CDC guidelines that are very specific on how to open up, and then our environmental division has been very active as well, going out to businesses, helping restaurants work through their processes, even helping our local businesses that have had some outbreaks, that have had a couple, several employees, providing guidance and even some policy in which other businesses have shared with us. So maybe the little bit of being that neutral convener to try to find solutions for folks. And then as time goes on, our environmental division will be there to support the restaurants, the places that are doing tattoos, all those different kind of small businesses that need assistance.
Very good, very good. All right, so let's move on to the next segment, which is the cautions or the concerns. What are some of the logical cautions or concerns having to do with health and reopening and going forward? And then if Joe or Lynn want to say anything to that particular area, I think they've done a good job on that. I just wondered if they had anything else they want to add, and then people can put in chat their thoughts.
Lynn, I don't know if you have any big, I can kind of jump in here too. There's always going to be issues, I think, with this COVID-19. One of the things is it's ever changing. Every single day, seems like there's something new that we have to adjust to, that we have to deal with. And that's going to continue and is going to be something that we're going to have to deal with. So, we have to try to anticipate, but it's going to be very difficult. And is, I think leads to a lot of the anxiety people have about opening up and moving things forward without maybe seeing, fewer and fewer cases. But, that's something that with the health department, we're always going to stay on the front line with the CDC guidance, with the ISDH. We're constantly looking to make sure we're on top of those things that are changing daily. But I think that to me is the biggest thing, that it just constantly moving, and we just don't know sometimes where it's going to go.
And then also, I'm guessing to share that good information, to keep that, if it's changing, to make sure other people can know about it. It's really difficult, I'm sure, to get out there.
Absolutely. And we always want people to go to our website, but we're always,
Well, and sometimes
go ahead, Lynn.
I think sometimes when we change, sometimes when we change the guidance, when things change up, first it was not wearing a mask, and then now it's wearing a mask, and things like that can be really confusing for folks, and maybe we even lose a little trust when we change up the guidance. And it's not that we're making things up, it's just things have changed.
Very good. Then there's a concern from Anna. She was talking about travel implications and starting to venture out and how to do that safely. Yeah.
Well, we've even had to address this with our workforce. There's safe travel and there's unsafe travel. So you really have to almost put it in different tiers on how you're traveling. Traveling with your family in a car to a destination in which your family unit or just your close circle is much less risky than getting on a plane and traveling maybe to one of the hot spots. So you really have to take travel into context as we move forward and more things open up.
Very good. Okay, any areas in the black? Timothy, I think one just came up. Oh, okay. Yeah, seeing antagonism between people who do and those who do not follow the mask and social distancing guideline. I'm guilty. I'm guilty. I find myself peering over my mask at times, like, why aren't you wearing one? And I know that's not helpful, but it is frustrating. Do you recommend, if somebody is becoming getting too close to you, I try to say it in a nice way. I'll say, hey, do you mind letting me have my 6 feet? I mean, I kind of let them know if they're getting too close. Is that a recommendation to let people know if other folks are getting too near them?
I think individuals are always in charge of their own personal safety. That you have to be empowered to take control. If you feel like you're not in a safe position, that you're able to verbalize that or to remove yourself from that situation. I do understand that it's very difficult for business owners when they're wearing masks and people come in, they're showing the respect and gratitude towards their customers, but maybe that customer is not returning that respect to them. And I understand where that's very difficult as a shop owner or small business.
Is there anything, are there any communities that are requiring masks to go into stores and places?
In our community, yes.
But I mean, like are there other communities that are much stricter about it?
I can't speak to that. I think that, our community's been really good about embracing the CDC's recommendations and ISD, the Indiana State Department of Health recommendations. And I really think that comes from our community and community leaders. I'm sure that there are other communities in which their leadership maybe doesn't feel as strongly about following the science of the CDC, but our community does.
The other part of that,
I'm seeing a lot of people not wear masks. It's very disturbing to me to go to Lowe's, and I would say I'm in the lower percentage of people. Like, I would say there's me, and then for every one person with the mask, there's 2 or 3 that are not wearing them and appear to give no concern whatsoever. It's kind of disturbing. I don't mean to be a worrywart, but I don't know. I wish it was required.
and the other side of that, Lynn, and I think that the governor talked about this several times, especially when the plan first came out. A lot of this is, it can't be policed by, local government or even state government. It really is the responsibility of everybody to commit to protecting others, protecting, the people around you. Everybody has their opinions. Well, it's, I don't have it, and all this. There's so many unknowns, like Lynn has said. It's the responsibility of everybody. But local government, local health departments, we can provide guidance, we can provide help, maybe even help provide masks through different organizations, and there are a lot of them out there that are making masks. Even I think Leadership Evansville, or everyone, gave us some masks for staff and for different clients that we had, so which we really appreciate. But the thing about it is we just really have to focus and be responsible ourselves.
Yeah, be a good example. That's awesome. That's awesome. Okay, the next thing that we're going to, I think it's the red one, right? All right, so red is talking about the feelings. And I think some of that was coming out in the last one, but I think it's important to find out how people are feeling about opening up. And sometimes there's some mixed feelings. So go ahead. Denise is hopeful. Yes, talking about events and doing temperature checks, very good for asymptomatic. That's another white one, good. What is everybody feeling? Because I know I've got mixed feelings. There's times I feel one way and then another time hopefully and anxious. Kathleen, I'm right there with you. Okay. And how are you feel, Joe, Lynn, how do you all feel? Sitting where you're sitting, seeing what you're seeing. What are the feelings behind what's going on?
I think I'm right there with you. I'm a little hesitant, a little nervous sometimes, a little hopeful in other times, but always tired.
Yeah. Tired of feeling. Tired seems to be a consensus at the health department at times. I'm actually off this week to kind of recharge a little bit. So, we at the health department, we kind of run the gambit as well, but we see a lot of the feelings, and they come through in emails, and they, it's fear, it is anxiety. And then there are people out there that say, this is all we're going overboard and we need to get moving. And so they're concerned about, not moving fast enough. And we get business owners saying, hey, we gotta make sure that, we're able to get things going here. So I think the health department takes on a lot of maybe frustration at times, because there's just so much coming in and we're trying to work through it as best we can. I think that's the biggest one for me is frustration sometimes, because again, like Lynn said, we're all responsible for ourselves, and everybody needs to do their part.
Awesome. Thank you so much. All right, so there's some definitely things are coming in from the chats, and so there's a lot of mix here too, even from the same people. So yeah, some excitement, possibility. What I haven't seen a lot of in this round is lonely. I hope that the connecting through these kinds of ways are helping us to not feel alone in this. And that's certainly the message we want to give to our whole community, is that you're not alone and that Ellie is here to help. All right, let's go to the next one. And I believe it's green. All right, so green is all about how do we grow this thing, make it better, maybe innovate. So are there any ways we can think of in the areas of health and in reopening Evansville that we might be able to innovate or do something to make it better or to grow it?
Lynn, we need Dr. Spear for this one.
I know
He's our innovator. He always is our innovator.
Yeah.
Yep. I bet he's got some ideas, doesn't he?
He usually does. And
He usually does.
yeah, I think the biggest thing for him, and I don't want to speak for him, but is, continue to work together, obviously, which, again, we do really well in Vanderburgh County and Southwest Indiana. There's so many groups and agencies and community organizations and businesses, and everybody seems to really step up, and that's so big. for us here locally. Expanding that maybe and trying to bring in even others that maybe are looking for an opportunity to be a part of something and share their abilities and their skills and then help out as many people as we can out there.
Awesome. One of the things
And then-
we talked a lot about in my family and in the staff is gosh, when we're a little tired, and this is tricky, and sometimes we're a little nervous and afraid. So we've tried to apply a lot of grace. So if somebody isn't doing it just so right or the way we think, any of those kinds of things, how do we, or maybe they're crabby. I know I get crabby and bossy sometimes in the middle of this stuff. And those guys are pretty tolerant of me. So I keep thinking that, can I apply love? Can I apply servant leadership? And can I just give people a get out of jail free card if they're acting out because they're under so much pressure? So that's part of what we've been trying to do. And Lynn, were you speaking? Am I interrupted you?
No. I think, again, going back to, we're all kind of in charge of our own well-being, and when we empower ourselves, and I know one of the things Doc has kind of focused on as well is knowing those facts by educating yourself so that you can, in a non-judgmental way, educate others. By going to our website and knowing exactly how many numbers we have and what the latest trends have been, looking for those documents that are very fact-based and science-based, and be able to share those with the people around you without maybe getting all the way up in their face,
Hey, can you give the website, and Elizabeth, maybe you can put that to everyone. What is the website for the health department?
Well, we did get everything, and somebody can see, Elizabeth, at yourvchd.org.
Yeah.
And even now, we did get our website platform back up. If you just Google the Vanderburgh County Health Department, it'll come up now.
Okay, good.
Yeah.
Good. That's so important.
Lizzie had gotten that on there. Hey, Joe and Lynn, we did venture out this weekend and talked to a restaurant owner who said that they had put a blue light into their circulation system, and that this blue light was killing germs and recirculating. And Joe, what are you thinking?
I'm gonna let Van.
Is that
Yeah.
real?
I don't know a thing about it. I would have to do my homework. I'm not going to lie. I don't know anything about it. I can't pass judgment. I've had to educate myself.
We do know that ultraviolet light kills this virus.
Yeah.
So that if the blue light is emitting ultraviolet light, then that's possible.
Okay.
But we have heard, that's why I think some of the idea of, people getting out in the summertime, the more sun and more warmth and heat and is something that's going to slow the virus here. And so, we do know that. I don't know what kind of blue light that person has, but.
And the blue light's not going to change the people that you're within coughing distance of. I mean, that's not, it'd be recirculating the air, and great, that would cut down part of it. But we know transmission happens from either an aerosolization of when you cough, when you sneeze, when you sing, when you talk, that goes out and is inhaled by someone that's close to you.
Gotcha. Thank you.
Gosh, Lynn, that's kind of a weird description. I'm kind of like, I talk all the time. No, I'm kidding.
Wear your mask, Lynn. Wear your mask.
It's true. Okay, let's go to the last way of thinking, which is the blue. And the blue is about what can we do? What kind of actions can we take out of this? What do we see as ways that we could engage in helping, engage in making a difference? So if there's ways that you could see that if the health department knows ways that we could help you tell us what it is. We'll try to engage people. And if we have things that we think we could do to help the health department or the community make this better.
I would definitely be interested in hearing any ideas Ellie has to help us. As you know, we'll work with anybody. Public health, our motto is public health is a team sport, and we've got to have everybody helping and moving things in the right direction. So we would love to hear any ideas from anybody, and we will do our best to implement those and be a partner with Ellie and other groups to continue to move forward and make sure people have what they need, resources and information and all kinds. So.
And last week, there was a lot of emphasis on how to make it cool to wear a mask, like kind of doing almost a PR campaign about how, be cool, wear a mask kind of thing. And there were people signing up to say I would help with communications. And these are people like Timothy, who's the master of communication. He really is. And Kristen Tucker, I think, was willing to assist in communication through her magazines. I mean, like, we really had some momentum there. So if there's messages specific that you all can help us craft to get that word out, we got a team on it, I'll tell you.
That's a great idea. I think even maybe setting up a couple meetings or something just to talk with those groups and share ideas and how things would progress and then maybe even sharing that same message with other groups, local government, hospitals, businesses, all kinds. I think that's a great idea.
Awesome. And I think there's got to be, like, I want to have a mask that says badass. That's my favorite term. So like how do we personalize, Timothy, how do we personalize these masks? Or I don't know, it would be fun to have one that like looks like you're sticking your tongue out at people. I don't know. I'm feeling kind of funky today. I don't know. Not unusual.
There are a lot of very unique masks out there. They've made them for children greater than 2 years of age, and I've seen them some that have big lips on them. You'd like that one too, Lynn. And
yeah, I would.
that when you open your mouth a little wider, you can see them open mouth. I mean, there's a lot of cute things out there. I think that getting that message out too, that it's respect to others when you wear a mask.
Does wrapping fabric around kind of like a, like that?
Oh yeah, and the CDC has got recommendations for that as well. Yes, a bandana or whatever, any kind of face covering.
Yeah, I might start going with some scarf stuff. Maybe show the way it could be pretty or even fashionable.
Oh yeah.
Yeah.
And there's on Timothy because we like that. Yeah.
There's some places out there that that you can order them online, Lynn.
Okay, cool. Good to know. Maybe some fun videos. Hey, we could like do something like mask up, instead. My youngest, something was coming up and somebody was acting weird and she goes, "You just tell them to lawyer up." And I'm like, so maybe we could mask up. So we're going to have to make it fun, folks, or it's not going to be fun.
It's not. We're trying to do something fun. So mum is the word until tomorrow at 2:30, but the press release just went out. We're doing a battle of the fans to try and raise the last little bit of money here for the regional COVID response fund. So I'm a little hesitant to announce this because I don't see very many UE alumni, and Mike Schottmeyer and I are going to be co-captaining the UE team, but basically any university that has kind of a local presence, everyone has team captains, and we're going to see which school can raise the most for the regional response fund. So you know, I know a lot of people have made contributions, but we always have a little bit more. So, and everyone likes to win. So I will be on the phone quite a bit, and would encourage you, if you have an alma mater that has any sort of local alumni following, to really get involved in that. But the mayor's going to announce that tomorrow at 2:30. So we're really, really excited. There are 14 schools that have captains so far. So if you want to jump in or, you know, join a team or make a contribution, just look for that on social media tomorrow. Yeah, I mean, there are still people on this call who said they're basically going to donate.
That's awesome. Very good. Okay, anything else that we want to talk about or share at this point? We try to keep these under an hour. All of you, I hope you got the link to last week's information too, because that's really good. And then we'll capture all of this in a report and also send that to you. Joe and Lynn, thank you. And Joe, coming in on your vacation, dude.
Yeah, that's okay. I'm happy to do it. Appreciate the invite and being able to share.
No, we so appreciate it. And if there's anything else you think of that we need to put out there, you let us know. We want to help you in every way.
Thank you very much.
Thank you.
Thank you so
Thank
much,
you.
Lynn. Thanks for making that.
Thanks.
Bye.
Bye.
Everybody.